warfarin, aspirin. Yeah, if you have heart disease or you had stroke before, just consult a doctor, okay, before you take the antioxidant. Actually, if you have kidney disease, also be careful with the multivitamin, okay, and calcium. It might clash with the medication that you're taking. So you just ask your doctor, consult a doctor. So there's a way to ask your doctor, okay, just ask like this. I think these ingredients are good. I think it will benefit my health, but will it harm me or not if I take this? Okay, so and give some time for your doctor to look through the ingredient, yeah, before they can they tell you the answer. Because most, for example, like me, I've never come across pignogenol, okay, before I know about shop.com. So it's normal. We only give medicine. There are so many ingredients in the market, right? We can't know all of them. So give some time, yeah, to your doctor to find out, okay. So if your product cakes, right, is normal, it's usually due to the humidity, due to the temperature, okay, cold and warm, so it will be cake, but it doesn't actually affect the quality of the product. You can still take it, all right. Just try to put all the isotonics product in the refrigerator, okay. It will prevent all this from happening. I have a chiller at home personally just for isotonics, so I put all my isotonics in the chiller and nothing happened, all right. So sometimes you might find that there's some residuals at the bottom of the cup where you're taking isotonics. Is okay, don't worry, it's not stone, all right, because it's just the water, right? Our water saturation, mineral saturation is different depending on what kind of filter you use or whether you use filter or not. So our aim to actually make sure the solution that we mix come into isotonic state, and it is what that is promised in the bottle, the ingredient. So whatever extra, okay, oversaturated will be forming the residual. So I usually don't take this the residual left in the cup. It's okay, it's up to you, okay. Even if you take it, it wouldn't harm your body, all right. So the taste may be different because all these products are natural, okay. It is made naturally, okay. So 4 to 6 cap, okay, every time when you take it, okay. And then you don't have to mix it separately, okay. Everything together in one cup will do, okay. Don't have to be so tedious. It is designed to be mixed, each of them to be mixed together, okay, because we don't have iron in our isotonic line so far. If you are taking the abroad, okay, isotonic line, probably there's one prenatal, okay, prenatal formula. I forgot the name already. So there's iron content inside. So it's best not to be taken together with calcium because it will reduce the absorption of the iron, okay, in the supplementation. So it's not to be mixed together. But for now, all the isotonics in Malaysia, you can mix them, okay? You can mix and match, all right? Just that some of them will be taken after food, some of them before food. After food is, just now I've mentioned, D, all right, and our CoQ10. Okay, the rest are empty stomach. Of course, digestive enzyme, you can take it pre or post, it doesn't matter, all right? So do not mix it with coffee, juice, any carbonated drinks. It is meant to be taken with water only. If you want to drink this alkaline, if you are using alkaline water at home, make sure it doesn't exceed pH 8, okay? Then it will not affect our buffer system in the isotonic solution, okay? So some of them contain wheat, soy, yeast, gluten. So be careful if you have allergy towards it, okay? Or your friends and family, just test it, okay, before you really commit to it, all right? So here it comes to one of the topic, which is free radicals, all right? So in the normal state of our body, our human body actually exists free radicals and this antioxidant. Antioxidant is to fight against free radicals, okay, in our body already having these two things, all right. In a normal metabolism, our body will produce free radicals, and we need these free radicals, not too much. It should be exist in a balanced form, all right. If there are too much of free radicals, it will actually attack our cells, okay, and make our cells injured or mutated, okay. So what kind of condition will produce an extra amount of free radicals? Okay, look at the graph. UV light, okay, our ozone is getting thinner, right? Last time there are not much of UVA actually penetrates into the surface of the earth, yeah, because ozone has already absorbed it. But because the ozone is getting thinner, UVC can still it's still unable to reach us, okay? But nowadays a lot of UVA, okay, UVB as well. So all these things will produce a large amount of free radicals when it touches our skin, all right? And then ionizing radiation, okay, from the electronic device, from the factory, wherever. So a lot of pollutions as well. Smoking, bad habits, all right? Smoking, alcohol, all these things will create a lot of free radicals, okay? And how about inflammation? When our body having a lot of inflammation, for example, we fall sick, okay, we have any kind of chronic illnesses will exert certain amount of inflammation in our body. So all this inflammation will create a lot of free radicals. So when the amount of free radicals increase in our body and we didn't have enough antioxidant to actually counteract these free radicals, that's where disease happen. Because free radicals, when it attacks cells, when it attacks the cell membrane, the cell wall, okay, it will destroy the cell immunity, and the toxic substance can actually enter the cells, right? When it attacks the organelles, all these important organs in the cell, it will actually impair the metabolism happening within the cells. When it attack this DNA, okay, then it will make the cell to mutate, and thus what happened after that? It's a cancer process after that. All right. So free radicals is we have if you we have to pay attention. A lot of diseases are related to high amount of free radicals in the body. Yeah. So this diagram clearly show you how free radicals can harm our cells. Yeah, you have to know one thing is atom. Okay, free radicals need atom. They are just a wild a wild how to say not electrons, a wild nuclear. That's atom, sorry. Free radicals is a wild atom that has lost its electron. So it's trying to replace back its own electron to keep them stable back. So they will steal these electrons from the healthy atoms, okay? So these healthy atoms, once the electrons is actually stolen, they will become unhealthy and unstable, okay? And when this free radicals has this extra electron, will it become stable? It will not become stable as well. So they're doing harm to both themselves, okay, and the healthy atom. So antioxidant, on the other hand, is an atom which can actually donate a lot of electrons to free radicals, as well as those healthy atoms that has lost their electrons, okay. So antioxidant, how do we classify the power, the potency of antioxidant is by the amount of atom it can actually donate. Okay, some very basic antioxidant, for example, like vitamin C, vitamin E, they are good. Okay, we need it in our body, but it is about the amount of atom that they can actually donate. For example, vitamin D is a great warrior. It can fight a lot of free radicals, but once they fight, okay, they will diminish because they have very limited amount of electrons to actually donate. Some of them will even become unstable itself, okay, when it donates out their electrons. So why now we are mentioning about super antioxidant? This super antioxidant, unlike this normal antioxidant, they have a lot of electrons to donate even to the normal antioxidant to make them to be able to use again. All right, so it is called super antioxidant. Okay, so before when we come to when we go to antioxidant, there's one thing that we must know, yeah, because maybe you may heard a lot of people say tell you that there's no need to take supplementation because I have a balanced food. Okay, I eat 5 colors of veggies and fruits every day. Okay, congratulations to them. If really they can take 5 colors of veg and fruits every day and 5 portions of veggies, there's colors, 5 portions of veggies and 5 portions of fruits on top of that balanced amount of carbohydrate and protein. Okay, bravo. Maybe he's okay, like his nutrients balance. Okay, but most of the people unable to do this. All right, and on top of that, actually the nutrients that we contain in this natural food has already been reducing. All right, has already been reducing. There are a lot of scientific research has been done, research on the amount of nutrient contained in this food. Okay, take apple for an example. 60 years ago, one apple contains around 34 milligram of iron. Okay, iron is what makes this apple turn brown. Okay, when we cut it open, right? But nowadays it's not the same anymore. 20 years later, okay, if we want to get the same amount of iron, okay, which is our daily needs, okay, that 34 milligram. If we want to get the same amount of iron, we have to take 24 apples. We have to take 24 apples. So do you take 24 apples a day? Okay, not really, right? I think one also sometimes we can't. Okay, we can't finish it. So the food are not the same as last time anymore. And as a result, we are having a lot of suboptimum health issue nowadays without us realizing. Okay, we are so picky on food. We always take outside food. We don't cook. Okay, even if we cook, maybe 1 or 2 meals a day, and then we can't really say that, we can't promise that we are taking all kind of varieties of food. Okay, you're trying to do your best. Of course, we encourage us to do the best. Okay, food is still the most natural, the most best form, okay, of nutrients source. Okay, but on top of that, it might not be enough for the people, for us nowadays. Yeah, if you are having suboptimal health issue, for example, you often got sick. Okay, you often have headache, you have aching here and there. Sometimes you have pain in your chest, or you have swelling in your leg. Okay, you feel weak, you feel sleepy, even though you have already taken your coffee whenever, or you have already addicted to coffee every day. So that is definitely an alarm to you. Your body needs your attention. Okay, do not let them addict to something that is not healthy. For example, coffee, right? It is not healthy. You know that coffee will actually harm your stomach. Okay, people who drink coffee often will have gastritis issue or indigestion issue. That's normal. All right, and then in the long run, you might get osteoporosis if you're drinking more than 2 cups of coffee. So some extra knowledge over here. Okay, and then anyway, we come back to multivitamin. So when we are depleted, when we deplete, okay, we are depleted of these nutrients and minerals in our body. Okay, it actually do harm to our body. Okay, because we need vitamins and mineral to keep our life going. Actually is to keep us alive. Yeah, the basic content of how to say, the multivitamin contain RDA only. So it is the amount that keep us alive. It's not yet to keep us healthy enough or optimum health. This is just merely enough for us to alive. So multivitamin is a must for everybody. If you ask me which one to choose to start with, okay, if you don't have any issues, you start with OPC3 and multivitamin. That is the golden pair. You will not go wrong with this. Yeah, if you have already taken antioxidant for a long time, and then you feel like, hey, how come I didn't feel any difference, or I still go back to the tired or whatever tiredness, then maybe you are lack of vitamins and minerals. That is at the, how to say, not surfactant, is an activator of this antioxidation process. Okay, you need mineral and vitamins to keep this antioxidant process healthy and ongoing in your body. So our multivitamin and minerals contain more than 21 essential vitamins. Okay, in Malaysia, most of us are depleted of iron, selenium, iron, selenium, vitamin D. Yeah, most of us are depleted of this already, and it's already included in these multivitamins. Okay, so it can actually solve quite a lot of suboptimum health issue with this one bottle alone. All right, some tips and testimonial maybe. If I my own self lah, if I'm getting sick, okay, not only I take more amount of aloe vera, because you know aloe vera has a lot of vitamins and enzyme in it, right? And also it has polysaccharides that help us to boost the immune system. I also take more of multivitamins, yeah, because we want to help our body to regain this energy. So you can take I usually take 2 to 3. All right. Okay, so normal, if nothing happened, if your diet is okay, yeah, you just take 1 cap a day. So the next product will be our famous OPC3. It's our star product. If you are a UFO and you're not taking OPC3, I would say that please take OPC3, because we have it at such a cheap price. Okay, it is so precious. The ingredient is so precious. What do we have in OPC3? First of all, we have this pine bark extract, pycnogenol. Okay, we have grape seed, okay, grape skin, bilberry, and citrus bioflavonoid. So if you have never heard about pycnogenol, it's okay. All right, but definitely you have heard about grape seed, grape skin, bilberry, citrus bioflavonoid. These are the 3 most common antioxidants that we have come across so far. Everybody is talking about grapeseed. Everybody is talking about grape skin. Just that grapeseed and grape skin alone is quite expensive. But look at our OPC3. It even has the king of all antioxidant, which is pycnogenol. All right. Pycnogenol is a pine bark extract, OPC stands for oligomeric proanthocyanidin. It itself is a very powerful antioxidant, a super antioxidant. Add on grapeseed, grape skin, and bilberry, it becomes 3 of them. So it is like super antioxidant. Okay, so it helps in the varieties of the amount of oxidation process we can actually overcome, and also it goes into the deadness, because pycnogenol can do a lot of things. Yeah, it comes from this French maritime forest. Yeah, it is unpolluted. It has more than 40 years of research. Okay, more than 200 clinical studies already. Okay, it has been publishing clinical study all this long. The effect, yeah, the good effect, the goodness of it on our health, it's just been non-stop. Okay, every year they're coming up with with research with good effect on our health. Recently there is if you want to talk about the effect, one of it is it can really reduce the amount of free radicals in our body. Okay, a lot. Okay, it actually has 2 patency on this. Okay, it can really reduce the amount of free radicals. Second thing is can actually help our blood vessels to become healthy again. So a lot of things, a lot of diseases are actually related to uh, um, how to say, the blood vessel, which has already lost its how to say, lost the elasticity. Yeah, it's like the rubber band. Our blood vessel should work as a rubber band because it's so elastic, right? So when the rubber band has become old, right, become seasoned, it will lose its elasticity. Okay, when you stretch it, it will just maintain it that way. So a lot of time when our blood vessel become like this, that is where we can't control our blood pressure, and it will affect on our heart and our liver and the general health. Okay, we want our blood vessel to maintain its elasticity. Okay, so one of the main ingredient of a healthy blood vessel is actually nitric oxide. Okay, NO, nitric oxide. It helps the blood vessel to dilate and to constrict. Okay, so that we can regulate our blood pressure. So when we age, when we are having problem with blood vessel, when we have atherosclerosis, that's where we do not have enough nitric oxide in our body. Okay, so what happens is in pycnogenol that it can actually stimulate the production of nitric oxide naturally in our blood vessel and help us to regulate back, okay, our blood pressure. Okay, it also reduces the amount of free radicals within the blood vessel itself, so that there is no free radicals, no inflammation going on. Even though you have a lot of cholesterol, they will not start any atherosclerosis process. Okay, it doesn't. Atherosclerosis doesn't only triggered by a single factor. Okay, if you have high amount of cholesterol, it's all right. Okay, if your body is not having inflammation, you're not going to have any how to say, illness related to it. It has 3 factors. One is the bad cholesterol. Second one, high amount of free radicals. Third one is an unhealthy blood vessels. These three combined together will cause atherosclerosis, which is the main risk factor of getting heart disease and stroke. All right, so it is a chain reaction. So if pycnogenol can help your blood vessel to become healthy, it also reduces the platelet from aggregating. So it prevents your blood to become very thick. Okay, prevents your blood to become thick and stop clotting at the blood vessels. Okay, there are a lot of benefits of pycnogenol actually. If you would like to know more, there is a website here, www.pycnogenol.com. Okay, please research, okay, and pick your own favorite language, and then you can find out there are a lot of infography, a lot of scientific paper that published in this that put in the website. Okay, so I just continue to tell you a bit more. If you have if for women, right, if you have a period pain, okay, menstrual pain, okay, especially if your pain is caused by endometriosis. Yeah, what is endometriosis? Endometriosis is basically your uterus lining, right, is going to shed. It's going to shed. Okay, shed, and then it become your menstrual period, become the blood, right? Okay, every month you're supposed to shed it. Okay, but this uterus lining has migrate to some other places. For example, your fallopian tube, your ovary, okay, out of your uterus. It is possible. So it will cause a great pain when you are having menstrual cycle. So Pycnogenol has a very good research and study on this. All right, and then most of the people experience a reducing amount of pain and then to no pain at all after they're taking a few months of Pycnogenol. All right, so it is definitely better than taking analgesic. Okay, of course, analgesic, it will not cure. I mean, it will not stop the pain from going. It's just temporarily blunting your sensation on it. That's all, and then it has a lot of side effect. Okay, so what else Pycnogenol can do? Quite a lot of things. If you have friends or family is having kidney problem, okay, they like to say that urine got bubble. They say got protein in the urine, right? It is not just because there's bubble. If you have bubble, it doesn't mean that you have protein in your urine. You have to check it in your clinic setting, okay? If the stripe tell you there's protein, then you have protein in your urine. So it's not a good thing to have protein in your urine. That means there's something going on in the kidney itself, all right? It might be inflammation, okay? It might be infection. So you have to pay attention to that. So there's a study in pycnogenol.com. They study about this the phenomenon called protein in the urine is called proteinuria, right? They after that take Pycnogenol can actually reduce the amount of protein, okay, that's leaking out from the kidney. So that means it actually improves the kidney condition, okay, through Pycnogenol. All right, and then for the woman who has premenopausal syndrome, okay, great news, because so far this condition can only be relieved symptomatically. For example, you might, premenopausal syndrome, postmenopausal syndrome, sorry, post, not pre. P also can, pre also can with Pycnogenol, post also definitely. Because when women are getting, cessation of this menstrual cycle, their body are having a big fluctuation of hormonal changes. So it's very uncomfortable. They may experience a surge of blood pressure, a flush, hot flush, unable to sleep, here pain, there pain, fever, headache, often fall sick. A lot of things can happen within these two years of period, 2 years of duration. So usually we just give symptomatic relief. For example, if you have fever, we just give you paracetamol to relieve the fever, so on, so on. Very seldom women will need hormonal therapy for that. Okay, but Pycnogenol, great news, it can actually improve these postmenopausal symptoms very much. Okay, and in all dimensions. It's not just reduce the hot flush. Yeah, if you're having this, unfortunately, okay, but with Pycnogenol, it can help you to relieve and help you to go through this PMS smoothly. All right, and it doesn't cause any fluctuation of hormone in your body. That's the beauty part of it. Okay, top to bottom, a lot of things. Okay, what else? If you're having varicosity, okay, it's another difficult dilemma in medicine, because varicose vein, do you know that about that? Varicose vein meaning the dilatation of your vein in the lower limb. Okay, maybe sometimes you can see this green line going on in the back of your calf, your calf lah. So it's not just green line, sometimes it's dilated. It looks like a pipe like that. So, that's very dangerous. In our medical treatment, we often advise you to use varicose stocking, right? So you have to wait like 8 hours a day, and then at night you have to elevate your leg so that the blood flow can be good. Okay, it doesn't clog there. Okay, so the treatments are very similar, okay, and very limited. So if you add on Pycnogenol on top of the normal treatment, it can actually help to reduce the symptoms that brought by this varicosity a lot. Okay, for example, the pain in your lower limb. Okay, if you often need to stand in your work, right? This Pycnogenol can help you to reduce the pain in your lower limb. Okay, of course, it can also reduce the clogging of this blood in your dilated vein. All right, so this is what Pycnogenol can do. There are a lot. So basically, it's a must, okay, for your general health. Okay, especially if you take 2 cap a day, the protection towards cardiovascular health is very good. All right, it depends on the dosing that you take. Okay, I always advise, if you take Pycnogenol OPC3, please take 2 caps. Because why? If you're taking 1 cap, it's only going to do you a basic protection of your health. But if you take 2 caps, it's the active prevention of a better heart, a better heart, a better immune system, why not just take 2 caps? Yeah, and then it's not so expensive if you are an unfranchised owner. All right. And it gives us a lot of BB. All right, so another type of antioxidant is actually vitamin C, the basic antioxidant of all. We cannot produce vitamin C within our body. We always get it from the external foods source. For example, vegetables, fruits, they have a high amount of vitamin C. But unfortunately, vitamin C is a very fragile vitamin. Okay, if you take it whole food, it's better to take it in whole food, so raw food. Okay, for example, just orange, don't blend it, do not cook it, of course. You will destroy the vitamin C inside. All right, so vitamin C, why so important? Apart from reducing the free radicals in our body, it helps to boost the immunity. All right, and then it also helps us to build the collagen in our body. Right, collagen is very important for women. Yeah. Okay, so this is the basic structure of ascorbic acid, all right, in the scientific term. Usually you got this vitamin C from all these fruits that you can see in the pictures. Okay, so basically it is, okay, and another thing, okay, I would say that women especially important, apart from generating collagen, okay, with the help of vitamin C, we actually need iron to generate collagen. If you have enough amount of iron, your collagen will be firm, okay, will be more abundantly, okay. But iron, sometimes we seldom take it from the food, right? Sometimes we can take it from spinach, from the meat, okay, red meat, okay. But if you do not prefer those kind of things, you can actually take more vitamin C to help this the absorption of iron in your body. Okay, so iron, vitamin C is inseparable. Okay, and if you want to have a good a nice amount, a good coating of collagen, so you have to take these two. All right, we don't have iron in our isotonics, but we always can take it from the natural source, with the help of vitamin C. Okay, so high dose, okay, 1 gram a day is quite normal. If you want to take 1 cap of 500 milligram vitamin C, also quite okay enough. But if you have special case, for example, to just tell you my own experience, I was having a quite terrible flu that day. I purposely didn't want to take any medicine because those medicine for flu will always make us drowsy, right? So what I did is I take 4 caps of vitamin C. Okay, immediately after 10 minutes, I can feel the difference. The nose was relieved. Okay, it was totally clear already, and I don't feel the dryness in my throat anymore. So that state actually can maintain for a few hours, and then it comes back. Okay, so I expected that. Why? Because our body, when we are sick, we are constantly generating a lot of free radicals. Okay, it is not that we only generate free radicals in the morning, so we take 1 shot in the morning. If you want to take a relatively higher amount of antioxidant, I advise you to take it throughout the day. For example, morning 2 and then evening 2 and night 2, something like that. Okay, so can help you to fight against the free radicals in your body. So vitamin C has some kind of antihistamine effect. Actually, can relieve your nose. If next time you can actually try it. Okay, so the next product, okay, we are coming to the Isotonics Calcium Plus. All right, Isotonics Calcium Plus, right, with a combination of vitamin D over here, D3, magnesium, vitamin C, and boron. Okay, so all this will help us to absorb calcium. Okay, the normal calcium supplementation that you can get from the market is actually most of the time is calcium carbonate. Okay, calcium carbonate need to take after food because the absorption is best with food, but still it is the lowest absorption, calcium supplementation with the lowest absorption rate. All right, why it is widely how to say marketed? Because it is cheap. Okay, one of the cheapest calcium you can get in the market, but too bad the absorption is not good. All right, happened to a lot of patients. One of my friend, actually, she has kidney failure. Okay, it's her own congenital issue. So she was born with kidney problem. So when she was approaching 25 years old, she's already having kidney failure. She need to dialyze, okay, in order to maintain, to keep her alive. So when kidney fail, one of the thing is that it will not produce any D anymore, vitamin D3 anymore, and then you will be losing calcium in the urine. All right. So they will definitely have calcium depleted. So this friend, she's very compliant because she herself is a jururawat masyarakat, meaning she's not a nurse, but she's a, how to say, healthcare assistant. Yeah, healthcare assistant in the hospital. So she's very compliant to the medication she's taking, which is calcium carbonate, okay, every day, and with the vitamin D extra, but in tablet form. But what happened to her is that one day when she was walking to the dialysis center, suddenly she just fell on the ground. Okay, she was just walking. She just fell on the ground. And what happened to her is that she had a bone fracture on the femur. Femur. You know where's femur? Femur is here, the largest bone of our body. So you probably need a really serious car accident to get it fractured. Okay. So what does it mean? She is having osteoporosis still, even she is so compliant to the medication, she's not absorbing the calcium. All right. So it is very important to take a calcium supplementation which our body can really absorb well. So what we have in our calcium, apart from calcium carbonate, we have calcium citrate, we have calcium lactate, 5 essential calcium. Why is it not moving? 5 calcium, okay, in this small bottle itself. So it ensures our small intestine are really absorbing all this calcium inside. Just by this small bottle, actually I have a lot of testimonials about it already, because I don't know why my friends and families are always having fracture, small fractures. So after that, take this calcium supplementation, it helped the healing process to speed up. All right, and the bone actually united quite well. So if you know that your friends and family are having certain fractures or body ache, those kind of things, please introduce them our calcium. It's really cheap, it's really cheap. It's even cheaper than, a day is only 1 ringgit, I think, 1 ringgit. Yeah. So why not? Okay, very cheap supplementation and it works really well. Who needs calcium? Okay, who needs calcium? All of us, especially women. Okay, women who is more than 30 years old, you will start to lose calcium already. Okay, because of our human nature, we will start losing calcium when we surpass 30 years old. Okay, when our period stop, when we are having menopause, okay, we will lose calcium like you are losing, like you're losing money like that. Okay, so every day you will lose calcium. So please stock up your calcium before you reach your menopause. Okay, calcium, if it's a normal requirement every day, just 1 cap. Okay, if you're pregnant, if you're breastfeeding, please, okay, add up to 2 caps at least, okay, to 3 caps depending on the amount of breast milk you produce. All right. Why pregnant women need extra calcium? Okay, because we have a baby, right, in our womb that is growing. We are forming bones in the baby. So you may be heard before that pregnant ladies, sometimes their teeth easily, how to say, they will lose their teeth, right? The teeth will become loosened easily, or they easily get caries. Okay, because bone, teeth, and these cuticles we call nails are part of the bone system, part of the skeletal system. Okay, if we don't have strong bones, okay, often we have problem with teeth. Okay, we have problem with our nails. So when the baby is growing in the womb, and then they need calcium to build the bones, right? If where do they get this calcium? They get it from the mother. From the mother. If the mother herself doesn't have enough calcium, they will actually eat up the bone, okay, to give this baby the calcium. So as a side effect, the teeth become unhealthy, get caries, or it will fall. Okay, so pregnant woman definitely calcium. Okay, and it tastes very well. Breastfeeding, okay, I maybe don't have to explain, right? The breastfeeding milk contains high amount of calcium to help our baby. So we need to definitely supply back the calcium, okay, that we are losing, right? So how about for men? Men, Men will also lose calcium. It's just that the amount is not as bad as a woman. But men with high, not men only, people with high, high, how to say, intent. If you exercise a lot, okay, you have high loading of exercise. If you do gym, okay, you definitely need extra amount of calcium. Why? Because the contraction, okay, if you're moving your muscle, right, you're training your muscle, it requires calcium. Okay, there is a fracture called sportsman fracture. Sportsman fracture. Even though if you are young, if you're active in sport, you're doing heavy sport, okay, this muscles contraction will attract, okay, will cause your bone to lose calcium. Okay, it is indirectly causing you to have osteoporosis if you don't replace back this calcium, so you get fracture, okay, at the end of the day. So please pay attention on this. All right. So the next one I would like to introduce to you is our B complex. Okay, B complex in another name is our happy vitamins or the energy vitamins. Okay, it is so essential in converting the basic part. Is it what is it? The basic structure of the food. For example, amino acid, fats, and then sugar. Sorry, glucose, and fatty acid, and then protein, amino acid. I just repeat. Oh no, I complete already. So it's very essential in converting all these food, okay, particles into energy. Without B complex, you cannot do this. Okay, how much you eat also, you feel no energy. Okay, you feel weak. Okay, you don't have you are not growing meat, growing fat. Okay, if you don't have B complex, so it's very essential. Usually B complex we can generate in the few places, stomach, okay, and in our small intestine by these probiotics that is in our intestine. Okay, help to generate B complex and help us to absorb in our body. So if you have friends or family who have stomach issue, for example, gastritis, or they have resected the stomach, or they often has indigestion issue, definitely they will be lacking in vitamin B. They cannot absorb vitamin B. Yeah, or if they often have constipation, they often have diarrhea issue, they also have difficulty in absorbing vitamin B. So you have to supply them with extra vitamin B. Who else needs vitamin B? Those people with extra stress, okay, because vitamin B is a very not to say fragile, highly usable vitamin B vitamins. If you're having a little bit of stress only, your vitamin B level in your body will drop drastically. Okay, so if you have more stress, you need more vitamin B, okay, to actually overcome, okay, to replace back the vitamin B. And it's a water soluble vitamin, so do not worry about intoxication. It will lose daily, okay, through your urine. Okay, you have to replace it every day. You definitely have to replace it every day. Okay, so our B complex comes with magnesium and potassium also. Okay, good for our heart. Okay, it's good. It supports in our red blood cell formation. Yeah, if you have anemic, okay, you definitely have to have to add more iron and vitamin B, okay, in your diet, or okay, from the supplementation to help you to get a good amount of red blood cell. Right? Who else? That's all. Vegetarian. Did I mention vegetarian? Not yet. So vitamin B most of the time will exist. You can get it from the meat source. Yeah. So if you have friends who are vegetarian, they need vitamin B. All right. Introduce vitamin B. It will help them to have more energy. It will help them a lot. And if they are pure vegan, okay, you need to add on calcium. You need to add on calcium. Okay. But please ask them, okay, if they are not paying, never mind. Okay, maybe you can tell them, because D3 actually derived from the wool, from the sheep wool, it's not from the meat, okay, but it's still derived from the animal, because from the wool. Okay, so you may ask them if they care or not about the source stuff. To me, I don't think it's an animal thing lah, but you can always ask. Okay, so if they can take calcium and vitamin B, it will be the best for their health. Okay, next one is our digestive enzyme. We have up to 7 types of enzyme over here. Okay, amylase. Let me see. Amylase. Okay. Lactase, maltase, invertase, those are to digest the carbohydrates. Okay, there are many types of carbohydrates in our body, so those are to digest the carbohydrates, and proteins to digest the protein. Cellulase, you know, from the vegetables. Okay, and then lipase to digest the fat. Okay, basically it covers general all types of nutrients, yeah, that we take from the food. So if you're having indigestion issue, you're having bloating issue, please take this digestive enzyme. I personally have a family member who has suffered from indigestion and bloating for many years. Okay, she has tried many products. Okay, it just temporarily relieved the symptoms, but it never really helped. Whenever she takes banana or she takes glutinous rice, right, it will cause this bloating issue, and for few days she cannot. Okay, some people may just have a very weak digestive system and don't have enough enzyme, so you have to help to supply this enzyme from external source lah. And who else needs extra enzyme? A senior citizen, because our body naturally will produce enzyme, but when we age, we do not have enough building blocks to actually produce enough enzyme. Okay, that's why you see old people often suffer from indigestion and bloating issue and constipation. Okay, so it is one of the side effect from this not enough this enzyme. If they're having problem with digestion some more, okay, it's definitely there are lack of enzyme, so need to get help from this digestive enzyme. All right, so if you want to take it pre-food, okay, it's okay. Okay, so to me, there's no difference when you take it before or after. Actually, really no difference, because when it reaches the stomach, it's still going to mix with food, right? Because it's a digestive enzyme. But the only difference is that if you want to take it early in the morning, okay, you have to cleanse your colon more. Okay, you have to cleanse your colon more. When you take it after food, okay, it helps you to relieve this indigestion issue and bloating issue more. Okay, all right, so enzyme. Okay, the function of enzyme is actually to break down, okay, the food in our body. You see from the chart, from the carbohydrates, okay, what's the food source of carbohydrate? Our bread, our rice, our noodles, okay, they are all carbohydrates. So through the amylase, okay, or maltase, lactase, it will break down into the small particles called glucose. And so what happened to protein and oil is also the same. Okay, when you have a certain special condition called maybe lactose intolerance, so the lactose intolerance is a condition where you cannot take milk or cheese, and dairy products. Milk, cheese, dairy products. Okay, yeah, that's all. So if you take those, you get diarrhea. Okay, some people are born with a lactase deficiency. Lactase deficiency means their body cannot digest lactose. Okay, some people it is a secondary process. That means they have this enzyme, but it's due to certain things. For example, they are stressed up, okay, lack of calcium, or they have a digestive issue, their body getting ill. Okay, they may get temporarily like lactose intolerance. So if you got that, okay, you might need to take digestive enzyme to help your body to overcome it. All right, and then slowly, perhaps, okay, you will not get this issue anymore. Okay, so I just remember okay, one of my friend, yeah, what happened to her is that she has done a major operation on her digestive tract lah, because she had a pancreas tumor. You know where is pancreas? Pancreas is the main organ to produce enzyme. All right, she had a tumor, so she has to actually remove the whole pancreas and all the organs surrounding it. So she preserved part of the small intestine, part of the gastric. Okay, the rest is all being resected, including the gallbladder. So quite a problematic case, you know, because what happened is that after she recovered from the operation, she find out that a lot of food she cannot take because she doesn't have the enzyme anymore. Fatty food she can't take, milk she can't take, and then even if she take the food, right, she feel bloating, she feel indigestion, very uncomfortable feeling. So what happened is I introduced I didn't actually know that she had that operation. Okay, that was my mistake. So I previously I introduced her that 4 essential kit to her, plus omega-3. Okay, so this 5 she's taking without digestive enzyme. So she tells me that when she take 1 pills of that omega-3, she has diarrhea. fatty diarrhea. Okay, we call steatorrhea, meaning in the diarrhea is not normal diarrhea, it's a diarrhea built up made out of fat. Okay, so it's the omega-3 that's causing this thing. So I asked her why you cannot take fat, okay, then or oil. Then only I found out that she has done this major operation. She didn't tell me. So what happened is I asked her to, she take 2 pills that time. So I asked her to reduce to 1, okay, and then she add on 2 pills, 2 cap of digestive enzyme together with it. Then she didn't have that problem anymore. Okay. Why I didn't ask her to stop taking omega-3? Because omega-3 is essential in our body and she needs the omega-3. So to compensate it, she needs to take extra digestive enzyme, okay, to overcome the effect. And it really helped her, okay, helped her a lot just by this digestive enzyme alone. Okay, wait, hold on. Okay, so the next product we're going to talk about is our coenzyme Q10. These are the 3 products that's coming later. They are relatively new, okay, but not new, they're relatively new to market Malaysia only, okay, but they are already has been used by a lot of people in the market itself. So first of all, coenzyme Q10. So actually I love this this antioxidant a lot, okay, because before we come across a few super antioxidant like grapeseed, grape skin, those things. So coenzyme Q10 is one of the most famous antioxidant, okay, before this, because it is a natural antioxidant, all right, that is our body has, you know. It is not something that it is extra or extraordinary. It is something that we already have in our body, our natural antioxidant. We have it in our mitochondria, okay, in our cells. There's a place where generates energy, ATP, is called mitochondria, okay. There's a theory called mitochondrial aging theory, okay. The theory says so. Why we age, okay, why human age, all right. Human age because we have a lot of free radicals building up in our cells that's caused the cells to be aged, okay. So when our skin age, it become wrinkled, it become dry. When our eye age, okay, it will become dry as well, okay. Your vision will reduce, okay. When our heart age, okay, it will become weak, it cannot pump, okay. That is aging. So at the same time, they found actually with this aging process, okay, the amount of coenzyme Q10, okay, in the mitochondrion, okay, a place where we produce energy, all right, is diminishing. Okay, meaning the amount of antioxidant will diminish, okay. At the same time, our free radicals start to build up, okay, and so happen coenzyme mitochondrion actually has a lot of coenzyme Q10 in it, all right. Apart from mitochondria in every cells, okay, organs, okay, which contains most of the coenzyme Q10 is heart, kidney, and our liver. Okay, you maybe it, if you these 3 are the main organs in our body. You know, if we cannot live with, okay, we cannot live without any. Okay, we must live with all these organs, but the most important is heart, liver, and kidney really make a difference to our health. So if coenzyme Q10 is there in a high amount, meaning we need this, okay, to maintain, to keep us from aging, okay. At least age is a normal process, but at least we age gracefully, right? So coenzyme Q10 is so essential that it gives energy to the cells, okay, in our body, okay, especially for our heart, okay. In few researchers has shown that people with weak heart, okay, weak heart and heart attack is different. Heart attack is that you have an unhealthy heart vessels, okay, to clog, and then you get a heart attack, okay. Certain part of the heart, the cells will die off, okay, will die, and then it causes infarction, okay. But weak heart is different. Weak heart, people without heart, we call it coronary heart disease. People without problem in the heart vessel can get weak heart because it's an aging process, okay. If you do not take care of your heart, it will age faster. So how to differentiate? Okay, if let's say maybe you realize that 10 years ago, you used to be so energetic and you used to be so strong that you can actually climb up a few flight of stairs without having any shortness of breath, without having any palpitation. Palpitation meaning your heart is pumping fast, okay? But 10 years later, you find out that, even if you climb 1 flight of stairs, you start to have breath, you start to become breathlessness. Okay, and then you start to have a tachycardic, meaning palpitation. You feel your heart pumping very fast. Okay, so that is a sign of your heart is getting old, getting weak. Right? If in an advanced stage, okay, you might get pedal edema. We call that swelling in your lower limb. Okay, if it's so bad, okay, it can even up. The edema can even go up to your back. Okay, your lumbar side. So pedal edema that is related to heart is a bit different than the general puffiness that we have sometimes. Yeah, it is the pitting edema, meaning when you press into your lower limb, right, it will create a a a, uh, a how to say you create a depressed place over there. Forgot the word already, but that is called pitting edema. It's due to your weak heart. Okay, so especially for people who are more than 50 years old, I will highly recommend to add on coenzyme Q10, the basic block of this natural antioxidant. Yeah, and realize also for senior citizens, if they take this coenzyme Q10, the effect will be more profound and it brings more benefit to them actually. So our Q10, our coenzyme Q10 also coming with the 300 international, oh not 300, 200 international unit of vitamin E, okay, which is very precious. Vitamin E, right, it also protects our cell membrane from the harmful substance. Yeah, it also actually it's a factor to actually create a balanced hormone cycle in our body. So especially it is also especially good for skin. So when coenzyme Q then combined with vitamin E together, okay, the effect on skin is perfect. Okay, if you want to get a younger looking skin, okay, you definitely have to take coenzyme Q10. Okay, on top of that, you get a good heart, healthy heart. All right. So every day, 1 cup of coenzyme Q10. Okay, it contains 100 milligram. Okay, good enough for our daily requirement. All right, next is our bromelain enzyme. All right, bromelain enzyme, right? It is a proteolytic enzyme, meaning it digests protein. Okay, mainly is to digest protein. All right, so there are a lot of proteins that exist in this natural food. For example, papaya also that has a lot of proteins. Okay, why do we take bromelain? It's because it does not only help us to digest protein, it has another function. All right, our bromelain enzyme are derived from the stem itself. Okay, which is this part contain most of the enzyme. Okay, sorry, most of the enzyme property, okay, of all these, the whole pineapple. So apart from helping us to digest protein, okay, it has a very significant anti-inflammatory effect. Okay, anti-inflammatory effect. I like to combine bromelain enzyme together with other products. We always give combination. Okay, people. There's no single products that can help with all situations. Yeah, so the basic one is OPC3 and multivitamin that can do good. All right, but all other situation, right, you will at least require combination of few to get the effect. Yeah, it's just so okay. There's no single product that suits everything. Okay, even if they claim that all the disease can be cured, no, there's no such thing. Really, you have to go with your logic. So I will always like to combine, okay, this bromelain enzyme with a few other products. For example, if you are having arthritis, yeah, arthritis means inflammation of the joints. Okay, most of the time it's our knee. All right, there are different kind of arthritis. One is caused by the degeneration, meaning when we age, okay, our cartilage getting thinner, and then when we move, okay, this bone and bone they actually how to say they move. Forgot the word again. Okay, they create a lot of inflammation going on in the joints. Okay, and then your joints will be swollen. Okay, will be red, and then it will be painful. Okay, this condition will not simply cure, because the end of the basic building of this cartilage, yeah, is quite difficult to be reversed. Okay, the destroy of this cartilage is very difficult to be reversed. Yeah, so one main thing is we have to control the inflammation to stop, okay, this cartilage from losing. All right, so inflammation for arthritis, right, just now I said degeneration. Another type of arthritis is called rheumatoid arthritis. Okay, it is an autoimmune process, meaning our body fight our body tissue and causing inflammation. All right, young people can get arthritis. Okay, rheumatoid arthritis. So these two different kind, but products are quite the same. All right, if it's for degenerating arthritis, okay, what I will usually advise is first calcium. Remember, joint and bones are inseparable. If you have joints problem, remember you have to always help bone to build a stronger bone system as well. So calcium is definitely you need calcium. All right. Second thing is that I will couple up with OPC3 because OPC3 is the anti-inflammation effect of pycnogenol is also very profound, and it has a few studies on it. Okay, for general health as well. So calcium, OPC3, and the third product I will actually match together is bromelain enzyme. Okay, it has the immediate anti-inflammatory effect. Okay, it's so good that actually it actually perform a very analgesic effect as well. It reduces the pain. Yeah, reduce inflammation, reduce pain. All right. So couple up with it. All right. So I take it after food. I was always advised to take it after food. If you are having autoimmune arthritis, meaning it's not because of aging. Okay, maybe you are 30 years old and you're having joint pain. Okay, or even 40. You have to add on fish oil, omega-3, because omega-3 help with autoimmune inflammation very much. Okay, so you add on omega-3. All right, so 2 capsule daily on the empty stomach. Okay, so last but not least, vitamin D with K2. Okay, when Market Malaysia introduced this product, I was very excited because they introduced this product during MCO when the pandemic was quite bad, right? So we do not like other country. They have beta glucagon. They have probiotic. Yeah, we don't have this yet, but they come up with vitamin D is actually a great news for us because vitamin D, apart from helping our bone to strengthen our bone, it also helps in immune system because the differentiation of white blood cell. What is white blood cell? White blood cell is actually the police of our body. It helps us to fight against the harmful substance, fight against the virus, fight against this bacteria. So if our white blood cell is healthy, all right, is strong, so our immunity will be strong as well. So vitamin D, okay, actually enhance this process. So it helps in immunity as well. And there are a lot of researchers nowadays for the past 5 years, they realized that vitamin D, low level of vitamin D is actually associated with a lot of chronic illnesses, including cancer itself. Okay, so 80% of the world population is depleted of vitamin D. Okay, first is because of the food that we take. Okay, the source of vitamin D usually come from seafood. Okay, from deep sea fishes. Okay, and then from this egg yolk. All right, so this is the food that sometimes we seldom take lah. So food source, reduce in food source. Second thing is we do not go out to expose to UV light. Okay, because we need UV light, meaning sunlight, to actually help our body to generate vitamin D. We can generate vitamin D, but we need sunlight. So nowadays we apply sunblock a lot, right? So if we apply sunblock, okay, even if the UV reaches our skin, it doesn't penetrate our skin. Okay, so our body cannot detect it. All right, and then we will not generate enough vitamin D. Okay, so these few factors actually causing nowadays people are lack of vitamin D, and a lot of chronic illnesses come with it. All right, come with it. So make sure we have enough vitamin D in our body. We have 1 cap of this contains 600 international unit of vitamin D, a good amount to maintain a healthy life. Yeah, but if you need extra, okay, pregnant lady also nowadays are advised to take vitamin D. Yeah, what else? If you are pregnant, you can actually advise to take vitamin B, right? B complex, because we need folic acid. If you're conceiving, also you need to take folic acid. Okay, so vitamin B. Okay, second thing, calcium, just now I've mentioned. Third thing is omega-3. Okay, the DHA and EPA in fact help our body, our baby, to have a good brain development. All right, the fourth thing is actually this one, vitamin D. Nowadays are highly recommended to pregnant women. Okay, so The normal, the main function of vitamin D is to promote the normal bone mineralization, because without vitamin D, we cannot absorb calcium. All right. So you have to, if for a woman who is you know, you can test, right, your calcium level and bone density at clinic. So if it's already in a critical condition, you add on vitamin D to your calcium. It helps you to build a stronger bones. All right. So K2 basically is the same. So now it's 8:35. Okay, I will have a few Q&A session, and then we break for 5 minutes and come back for another the remaining nutrition supplementation. So let's see, chat. If you have questions, it's the time to post now. Okay. Chat. Okay. So I do not answer personal health problem, yeah, because that one will require consultation face-to-face. What product to take for gastric ulcer? Okay. Gastric ulcer. So if it's already an ulcer, okay, there are different stages of gastric problem. There will be gastritis, general inflammation of this gastric lining, okay, until there's ulcer. Ulcer, there are a few grades lah. Of course, I hope that you are not talking about those grade 3, grade 4, which is a bleeding ulcer. Those patients, you cannot take any food, okay? So if it's just a general inflammation of gastro lining, okay, sometimes you have indigestion, sometimes you have gastric pain with bloating issue. So I will recommend is aloe vera. I will recommend aloe vera juice first, okay? Dilute it with water, take it after meal, all right? Every day, 2 caps of aloe vera juice, okay? And that shouldn't hurt. If aloe vera juice also cannot help with your friend's problem, she will probably need to take medication first to stabilize her gastric, to stabilize her stomach. Then only after you introduce aloe vera juice. If she has bloating issue, add on digestive enzyme. Migraine. I have friends who have migraine. Okay, migraine, basically 2 products is very essential. Yeah, 2. If you want, can 3. Okay, first of all is actually the pycnogenol. Okay, OPC3 with pycnogenol. Okay, it has research on migraine, on headache issue. All right, and the second thing is B complex. Okay, B complex can help in headache. All right, if you have you done TLS before? 21 days TLS program. Okay, it's a great program, you know. One of the stages of TLS is that they actually ask you to reduce your sugar intake. So people who are used to high level of sugar, right? Okay, suddenly you withdraw sugar from them, okay, they will get headache. Okay, so what the trainer usually do is ask them to take more of a vitamin B complex, because it helps in this headache. Okay. Last question. Some doctors stop calcium for cancer patients, saying people with cancer produce calcium. So if additional calcium will be too much, what kind of cancer is that? Okay, this is special condition. All right. Some nutrients, how to say, calcium can actually prevent us from getting ovary cancer. You know, people who take calcium actually can prevent them from getting ovary cancer. And not all cancer will produce calcium. I've never heard breast calcium that can produce calcium, you know, in the body. But if it's so, okay, really proven with the blood test that she has extra calcium in the body, then don't take it. All right, then don't take it. It's okay. All right. Then where is the question? If you want to go to toilet, it's okay. Come back after 5 minutes. Okay. What product is recommended for improving lung capacity, such as improved stamina? Oh, there's 2 different things. If you want to improve lung capacity, that's pretty a specific word, you know. To me, I don't know what the lung capacity means to you, but to me, lung capacity is the amount of air that we can breathe in one shot. Okay, that is called lung capacity. Okay, so which type of people will have reduced lung capacity? Those people with pulmonary fibrosis. Okay, it means that stiffening, a stiff lung. Okay, people who smoke, all right, or who are exposed to dust, okay, in a high amount, okay, they might get lung fibrosis, so a stiff lung. So those patients will definitely reduce lung capacity. All right, so if you say you want a good heart and lung health, okay, because heart will always impact on lung will always impact on health, both of them are together. So if you want a good heart and lung health, okay, you can actually get just supply with make sure you have enough coenzyme Q10. Okay, it actually will balance up these two. If you're talking about stamina, okay, it's a different thing. If you mean exercise stamina, okay, stamina through the muscles, okay, you want to exercise longer, you want to run like 10 kilometer, 40 kilometer without feeling tired, those type. So you definitely need to train, right? One thing. Okay, second thing is you want to increase really exercising stamina, you can try astaxanthin, okay, which I will talk about it later. Astaxanthin has studied that actually improve stamina as well as OPC3. All right, okay, I think it's enough. Okay, questions are pouring, I need to continue. Give me a minute. Okay, the rest, right, I will answer it a bit later during the end of the session. Okay, need to continue or else we can't finish. Okay. Okay, so the next product will be our aloe vera juice. Okay, we have 3 flavor, natural, cranberry apple, and then also strawberry kiwi. Most of the people from starter pack will get natural and also strawberry kiwi, right? Okay, what I advise is that if you you pay attention on the sugar intake, okay, or if you have diabetes, you might need to get the natural flavor because it has no sugar content in it, or a very minimum of sugar compared with the rest of the aloe vera flavor. So strawberry basically are the sweetest among all, okay, but it comes from natural sweetness. All right, so aloe vera, right, here it is certified by IASE. So if you want to know whether this aloe vera is pure or not, okay, it has to be certified by IASC. Okay, this body basically going through all the aloe vera juice in the world. Okay, once you get their certified, that means this is a good quality aloe vera juice. All right, so it's free of this thing called elanin. I forgot already. Oh my god, what is the name? Imodin. So it's free of imodin. All right, so imodin is the substance that causing diarrhea if you drink a lot of aloe vera juice, and it is impossible, okay, to get rid of imodin when you are making your own aloe vera juice. Okay, it needs a very tedious process to do so. And our aloe vera juice, right, the patented technology is called active aloe. Okay, it is not only certified by IASC, it also derived through this technology called active aloe. Okay, it's a very tedious process. All right, and it require long hours of extraction. So this process enable our aloe vera juice to have an extra amount of nutrients, compared to the normal aloe vera juice. Normal aloe vera juice, if there has 100% of nutrients, enzyme, and so on, active aloe vera juice, which derive from this active aloe technology, will contain 50% more nutrients, okay, than the normal aloe vera juice. All right, so what is so important and special about aloe vera juice is that aloe vera contain polysaccharides. All right, polysaccharides is a substance that can actually boost our immune system. All right, it helps us with this anti-inflammatory process. Okay, so if you're getting ill, okay, if you are sick, or if you have a weak immune system, often fall sick, and you're looking for some natural food that can help you to boost up this immunity, aloe vera is a good choice. All right, and it's suitable for even children. All right, like isotonics wise is for adults, right? So aloe vera juice actually more than 2 years old. Okay, please welcome to take, but reduce the amount. Probably just 1 cup will do, and dilute it with water. Okay, so what else apart from boosting up the immune system? It is very good for the recovery of the membrane lining. Okay, what is membrane lining? Like our digestive tract, it is lined by membrane lining, right? Our gastric, okay, if you have gastritis, you need aloe vera. It can help you to recover this lining. All right, because of the natural how to say, the existence of this. When you cut cut the aloe vera leaf, right, you feel like there is sticky thing, sticky substance, right? The texture is sticky, so that is the thing that help us to actually improve, to recover our lining, because our lining actually contains a natural sticky lining as well, so it matches. All right, so if you have digestive problem, I recommend you to actually take it for at least 6 weeks, okay, before you introduce to other supplementation. Yeah, especially antioxidant, because we are talking about healing reaction. Yeah, in Mandarin is 好转反应. Okay, English is called healing reaction. Means if your body, right, uh, how to say, if we introduce antioxidant in our body, okay, if we are having not so ideal health, we definitely have already accumulated certain amount of toxin in our body. It may be in your joint, it may be in your digestive tract. Okay, so when we start to take antioxidant, we want to actually bring out this toxin, and we want to expel it. We don't need it in our body. So in the process, right, when we extracting this toxin deep from our body tissue, it will cause a healing reaction. Okay, your body will start to feel it. Okay, different people has different reaction. Somebody don't feel anything at all. Okay, it can be. So you are healthy people. Okay, so congratulations. Someone that might get headache. Okay, they might get constipation. They might suddenly get bloating, or they feel very tired. These are all healing process, healing reaction. So when we continue to take this antioxidant, okay, after 2 to 3 weeks, okay, this process will be over. Okay, and then you feel a better health. Okay, you feel a better health. You have a big improvement in your health. Okay, so if you don't want this, all right, let's say if you encounter a friend or family who has a bad lifestyle, okay, alcoholic, okay, burning midnight oil, okay, work too hard, very stressful, okay, this kind of people, you have already know that definitely she has a very bad suboptimal health issue. So with this kind of people, usually I will start with product, okay, that's related to digestive. Okay, for example, aloe juice, okay, you can try. And then evergreen, okay, evergreen is the first step. I can say it's a stepping stone of among all antioxidant, because it is very mild, gentle, okay, but it also does its job, and then it helps the liver to improve. Okay, so you might need to introduce evergreen first, okay, together with aloe digestive enzyme. If she's your not patient, if your friend or family is having constipation issue, make sure you cleanse the intestine well with Nutri-Clean. Okay, 6 weeks before you start to introduce antioxidant. Okay, then you have a big improvement, okay, in the health system. Okay, so I'll come back to aloe vera. Okay, aloe vera, apart from that, it also stabilizes our blood sugar. Okay, good for a patient with diabetes. That can help. Okay, also help with this aloe vera. Once you open this aloe vera bottle, please keep in the fridge. Okay, because it's still a natural fruit juice. So if you don't keep it in the fridge, it might spoil. All right, so keep it in the fridge. So second thing is the second one is this astaxanthin. All right, astaxanthin is a carotenoid, so one of the antioxidant. When we take astaxanthin, the first organ that it will go into, it will go into our eyes. Okay, second one is it will go into our brain. Okay, so because our eye contain a lot of carotenoids, okay, and And the truth is, carotenoid will help us to fight against the aging process of our eye. If our eye ages, okay, it will cause a cataract problem, it will cause macular degeneration. All of this build up pressure in the eyeball. All of this will cause blurring of the vision. So if we want to take care of our eye, you see our eyes exposed to so much of UV and radiation, yeah, definitely you need to take care of your eyes, okay? And you will want to take astaxanthin for this, okay? So it contains 6 milligram, one soft gel contains 6 milligram of astaxanthin, which equals to the amount of astaxanthin in 200 kilogram of salmon. Okay, just one soft gel equals to 200 milligram of salmon, okay? Which maybe you will need a year to take this 200 milligram of salmon, okay? But now you don't need, okay? You just take this one soft gel alone, okay? So there are a lot of patency of astaxanthin. One of it, of course, is reduce the free radical amount of free radical in our body. Second, it actually helps in the eye circulation, okay? Slow down the aging process. Third one is it help in our gastric problem. So if you have H. pylori, Helicobacter pylori bacteria constant in your stomach, and it will not go away, keep on coming. It causes indigestion, it causes bloating issue. You can try astaxanthin, yeah, okay, make a difference. And apart from that, just now we have mentioned about stamina, right? Astaxanthin is very good in helping to build up your body stamina, okay, increase your muscle strength, okay. So it is produced by okay. It is produced by oh sorry, what happened? Okay, it is extracted from the deep sea algae, okay, in a laboratory, which makes sure that the quality is actually very stable, okay, okay, of all throughout this all the soft gel, all right. And then astaxanthin is a 6,000. The potency of antioxidant is 6,000 more than vitamin C. Okay, why is it so much? All right, because okay, you just imagine the deep sea algae, how can it survive in ocean without any oxygen? Definitely it will create oxygen, it will create a lot of free radicals, you know. So they need a very high potency of antioxidant to overcome this pressure, this stress issue, okay. So that's why astaxanthin is one of the most powerful antioxidant in the market, okay. Too bad we do not have the isotonic form yet, okay, but in America we have it already. The impossible, it has become possible over here, yeah, because astaxanthin is a lipid soluble antioxidant. It actually live, okay, it can exist, you know, in between this cell layer, okay. What makes it so potent is because you see the normal water soluble antioxidant can only live, okay, or act on the surface of the cells, okay. It will not penetrate into the cells, okay. So astaxanthin, it is long enough, you see in the middle, yeah, the red color structure, okay. It penetrates the cell membrane and allows to work within the cell itself, okay. So it's really protective, okay, towards protective to our cells, okay. So it actually works well, okay, and in a higher intensity, okay. So the next product is actually curcumin plus, okay. Curcumin plus, this is the extract, okay, and the patented formulation is BCM 95. There are a lot of slide, don't know, there's a box over here. Okay. BCM 90.
You have to unshare and share it again. I think there's some
Oh,
problem.
is it? Sorry. Okay, I will try again. Okay. So is it okay now?
Thank you.
All right. No, thank you. Actually, I have to thank you. Okay. BCM 95, right, is among those curcumin extract that is can be absorbed well in our body, okay, up to 6 to 7 to 8 times more than the normal curcumin extract. So of curcumin is this kunyit, right? In Malay it's called kunyit. We often use to make curry and fried rice, right? Normally in one curcumin, in one turmeric turmeric is the food salt, food form. So one turmeric, we can only extract 3% of curcumin extract from it. Okay, 3% only that are beneficial to our health. And if that also, we do not have that much because our body naturally we cannot absorb fully this extract derived from plant based, So VCM 95 not only contain only curcumin extract, but it also has 7 to 8 times more absorption rate compared to the normal curcumin extract. So different antioxidant works differently, okay? I will recommend you, if you haven't find your perfect antioxidant yet, you please try different antioxidant, okay? If you have already tried OPC, okay, you have a good health, it's okay. Why not? You just try, sometimes you try curcumin, probably as you experience a different thing, okay? Some people will prefer curcumin compared to OPC3. They feel the curcumin more compared to OPC3. That's normal. It's okay because, like I say, every individual actually work differently. Okay, you can try. Okay, there's no harm. So one of the special thing of curcumin extract is that they can actually naturally elevate our own antioxidant in the liver, which is called glutathione. All right, liver is the most important organ which helps us to detoxification, to help in detoxification of our body. Okay, the process of detoxification is actually aided by this substance called glutathione. You see, there are two phases of this process, okay, happen in the liver. Toxins come into the liver, okay, it cannot be actually excreted without go through this process, okay. We call conjugation in scientific term. So it actually binds with water so that we can excrete out in the urine, okay, we can excrete in our feces, and you can excrete through the skin, okay, in the sweating form, right? So glutathione is very important in this process, okay. And curcumin, our curcumin can actually increase the glutathione level in our body itself, okay. So it strengthens our own body system to do this thing, all right. And then apart from glutathione, if you're tentative enough, you can realize actually vitamin B is equally important in this process. Yeah. So talk about liver, right? Actually, in Malaysia, okay, we have quite a high amount of people who gets cirrhosis, meaning fibrosis of the liver. Your liver is supposed to be elastic, okay, and it's a living object, okay, a living organ. But when it gets fibrous, become firm. It's like a stone, so it doesn't work anymore. Okay, it's a late stage of liver failure. Okay, one of the most common reason is alcohol. Okay, alcohol consumption is not hepatitis, all right, it's alcohol, because a lot of people drink alcohol, and slowly, if it's overdose, okay, it will cause your liver to become stiff and it will not work anymore. All right, so there are different kind of people or alcohol, we call it hangover, right? If you drink a little bit, maybe you feel a little bit high, okay. So if you drink a lot, you might have coma. Okay, there's a medical condition called alcohol intoxication, whereby your liver fail, okay, to actually excrete alcohol in your body anymore. And these alcohol substances keep on repeating, recycle in your body, and slowly it will make other organ fails as well. Okay, this is called alcohol intoxication. So the first treatment if we receive this kind of patient, the first treatment we give in the hospital is actually we will inject vitamin B. Okay, not inject glutathione, it cannot be made outside. So we inject vitamin B to help the liver to detoxify this alcohol and excrete in the urine. Okay, so vitamin B, if you have friends or family who like to drink, okay, make sure they supply enough, give them enough supply of vitamin B as well. Okay, apart from curcumin extract. Okay, you need curcumin extract to maintain a good liver. All right, so next will be omega-3. Okay, our omega-3 fish oil has a relative high amount of EPA and DHA ratio, which is it actually perform a active prevention or prophylaxis towards a good heart health system. There are few level of omega-3 that we can absorb. Okay, 3 levels basically. If you only take in like 1 gram of omega-3 per day, okay, it will bring you a basic health. All right, maybe just guarding your health only. But if you take 1 gram to 2 gram, okay, per day, okay, you are actually taking an active approach to protect your heart. Okay, if you take more than 2 gram, 2 to 3 gram, okay, it has even a better effect, okay, on anti-inflammation and so on and so on. All right, so fish oil can do this wonder. Okay, it is a good fatty acid, right? So it actually bring down the bad fatty acid in our body. So let's say cholesterol. Okay, cholesterol, we do not need a bad cholesterol in our body, right? So bad cholesterol such as such as what sorry, LDL. Okay, LDL, sorry, lousy. Yep, LDL is the one we don't need. Okay, triglyceride we don't need. Okay, so it will cause increase in cholesterol level. So if you have increased amount of HDL, okay, this good fatty acid, it will actually suppress the LDL in our body. Okay, so reduce the risk of getting atherosclerosis, heart disease, and stroke as well. So omega-3 also help in suppressing the inflammation caused by autoimmune disease. If you have joint pain, if you have SLE, systemic lupus erythematosus, okay, this kind of inflammation is or asthma, okay, you can actually take a higher amount of omega-3 to help to suppress the inflammation caused by this process. All right. So our omega-3 derive from the small fishes, okay, anchovies, tuna, okay, because the smaller fishes it is, okay, it is free of mercury, PCB, okay, and those heavy metal, lead, and all. It is very important because it is supplementation is something that we take every day, okay. Heavy metal, if we take in heavy metal, our body cannot excrete, and it will be kept in our body forever. So make sure our fish oil doesn't contain this heavy metal, okay? Then is our nutrition shake, okay, a product of TLS. It has 2 flavor, creamy vanilla, chocolate delight. All right. So I personally like to mix both of these. Okay. 1 spoon of nutrition shake. Okay. It contains 20 gram of protein, which equals to roughly 1 meal. Okay. 1 meal of protein. The 1 meal. The protein amount of a single meal lah. So if you're skipping meals, okay, better than not taking anything. Just take 1 cup of nutritional shake, okay. It gives you energy, okay, and it won't cause you fat lah because it's protein. So our nutritional shake also contain fiber salt too. Okay, it is a famous supplementation and ingredient in abroad already because fiber salt too, it is a soluble fiber. Okay, soluble fiber, apart from make sure our intestine contract smoothly, okay, it prevents constipation. It also helps us to regulate a healthy cholesterol level and sugar level within our body. All right, so fiber salt 2 helps in that way. Okay, other than that, it also contains a fair amount of minerals, okay, and vitamins, and a high amount of calcium. For those bodybuilder, this is a good source of calcium. Okay, 1 cup every day. Okay, so this 1 cup can actually serve you for 14 days. Okay, I like this because for those women, right, who are thin, skinny like me, face lah, okay, not the tummy. Tummy, I got tummy also, okay, but I don't have enough collagen. And the building blocks of collagen, apart from the taking in this OPC3, vitamin C, is to help to enhance the building of collagen, right? But we do not forget that the basic building blocks of collagen is actually from proteins. If we don't have enough protein, if we do not absorb enough protein from our daily meals, right, we will not have enough collagen. Yeah, so that's why I love about nutritional shake is it I am those type of people who don't like to take meat. I will take veggie, fruits more than meat. So each meal I maybe will take 1 or 2 pieces of chicken only. Okay, that's very little. Okay, it's not enough. So what I do is I make sure I get enough protein by taking nutritional shake. Okay, so it makes me have more collagen lah. That's why I'm taking it lah. So this one is a NutriClean. Okay, NutriClean contains fibersol 2 as well. It has fibersol 2 in the form of fibersol 2, and then it has L-glutamine, probiotics, and inulin inside. Okay, if you want to kickstart your digestive problem, kickstart a good digestive health, okay, you start it with NutriClean. Okay, make sure you have bowel movement every day. Okay, and you drink a lot of water with it. All right, basic requirement for water per day is at least 2 liters. Okay, for women. For men, you need to take more than 2.5 liter of water if you do not have any kidney or heart issue. All right, that is fair amount of water you should take every day. Couple up with NutriClean. Okay, and then it will help you to prevent constipation issue as well. There's probiotic inside. Okay, this probiotic can help you to maintain a healthy immune environment. Okay, a lot of inflammation in the digestive tract actually is caused by this disbalance of probiotic. And when this probiotic in our colon is disbalanced, it will actually affect our skin, affect our hair, affect our brain. Okay, it also likely will cause depression if we do not have a healthy digestive system. So glutamine is an amino acid that is proven to reduce the inflammation in our digestive tract. Okay, inulin is something that we call prebiotic. It helps to keep our probiotic, the good bacteria in our guts. Okay, to keep them longer in the guts. If without inulin, without prebiotic, right, we take in a good amount of probiotic, but after 5 days, okay, because we have to have to poo every day, right? We will likely excrete away this probiotic. But with prebiotic, okay, we can maintain them longer in our digestive tract. All right. So this tub is very tasty to drink. For me, I drink it with aloe vera juice. All right. So here comes this evergreen formula. Okay, evergreen formula contain a lot of different kind of antioxidant inside, but all of these antioxidant has a one common purpose that can help the liver to detox. All right, help the liver to detox, especially milk teaser. Milk teaser is an ingredient that is used in our pharmaceutical industry. Okay, so if in clinic, probably doctor will prescribe you milk teaser, but only milk teaser. Okay, to help you to improve your liver function. Okay, so milk teaser is proven to protect our liver cells from harmful substances. Okay, so apart from milk teaser, we have ginkgo biloba over here. Okay, in Malaysia. Okay, only in Malaysia. Ginkgo biloba helps in the brain memory issue lah. So if you're prone to dementia or Alzheimer, okay, it will help you to reduce the risk of getting your Alzheimer and dementia. Okay, then what else? We have vitamin C. Okay, vitamin A, E. Okay, selenium. Okay, which works very well with this detoxification process in the liver. Okay, all of this. Okay, green tea extract. Okay, catechin. This thing actually is very good in helping our mood stabilization. Okay, it can calm us down. It also help with us to sleep better. Okay, with this, but it doesn't contain any caffeine in our evergreen. All right. So I have mentioned that if you want to start a relatively mild antioxidant and to ensure that it works well, okay, evergreen is a good choice. Okay, and then after that you introduce your other antioxidant, a stronger antioxidant. All right, so we have done with our health and nutrition kits. All right, so all of these you can find in our catalogs and your back end. Okay, we also have prepared a package of products which help in certain system. Okay, thanks to Market Malaysia for this arrangement. Okay, so this is our antioxidant. Okay, range. Okay, buy 3 in a set is always cheaper than buying a single bottle. All right, so I always get 3. Okay, 3 bottles at once. Okay, so this is talking about this regulation of Malaysia. Of course, we have to go through a few registration in order for our product to be published and to be marketed in Malaysia. First of all, we have to get this MAL number from our DCA, okay, and KKM, yeah, for supplementation. So if you want to find out more, you can actually search it in the internet, all right, and then or you can call personally to the DCA to find out the legislate how to say again come up. Can I ignore it? Okay. So that is ML number. I have already done the research for you all. Actually, one by one, I have checked all. Okay, so you don't have to worry. And then you get a hologram label if this is a original product, okay, and you also get the halal certification, okay, from Market Malaysia, so it is safe to be introduced to our Muslim friends, okay, and Muslim friends. So there is the ML number. So hologram is the shiny sticker, okay, at the bottom of our products. Okay, our halal certification is from IFANCA, so it only works in Malaysia. If you have friends and family in other Muslim countries, so it is not really encouraged, yeah, to do so, okay, because it is a different certification. All right, this is only for Malaysia. Okay, so that's it. This is for health and nutrition products. Okay, so I would like to introduce a little bit, okay, of household product over here, because I came from dermatology department. I have seen a lot of housewife actually suffer from dermatitis. Okay, a very sad situation is that usually when they suffer from this disease, they have already reaching the age of 40 or 50. Okay, they may be housewife for their after they get married, they've been doing household, okay, and then washing, cleansing, everything, but everything was fine until they contracted this dermatitis, okay, at the age of 40 plus or 50. Okay, they will come and ask me, doctor, why now only my hands becoming like this? Okay, so what happened to the hand? Okay, most of them will have, if very mild stage, they'll have peeling of the hand, okay, just like itchy. Okay, if a bit more severe, they will get rashes. They will be very itchy. Those itchiness, right, is within the hand. You cannot relieve it by scratching, and very itchy. Okay, if it's this very serious type, it can crack, okay, at the distal end of your finger bulb. It can crack, it can bleed, so those are very difficult to treat. All right, so how come housewife will get this kind of dermatitis? It's very difficult to treat if you get this, so the best will be prevention. Yeah, they get dermatitis is because of the chemical inside the detergent. Most of the time the detergent that they use. All right, so normal detergent are made up of this chemical, which is very harmful to our skin. Our skin is also a cell that is living cells. Yeah, every time when we contact certain things, okay, it actually has effect on our skin. Okay, if every day we are doing this household activity, house chore, then sorry, if it's made out of chemical, okay, every day we are contacting it, okay, it will cause an inflammation within our skin itself. Okay, slowly our skin will start to reject it, okay, and it will start to tell you to draw your attention and say, don't let me touch this thing anymore. So by showing you the sign, peeling, rashes, bleeding, okay, this is the chronic contact of chemical. Okay, the result of chronic contact of chemical. So please, if you are a housewife or okay, woman nowadays, right, even if you are not a full-time housewife, you will need to do household chores also, right? So we do need to do all these things. So please protect our hand. Okay, protect our hand by love our hands or love our skin by using non-chemical derived detergents, okay, or cleanser. So our snap detergent, right, it contains, what does it contains? It contains natural enzyme, right? Okay, it's called triple enzyme because it has amylase, protease, and also this what we call this, the last one is to disintegrate the oil. It's getting late now. My tongue also getting tired. So three type of enzyme, okay, to remove the stain, to remove this stubborn stain on the clothes. Okay, so enzyme, do not say that okay, enzyme is good, we make our own enzyme. It's not the same. Okay, this formulated enzyme is different from the enzyme that we make our own. Okay, I have witnessed many cases that they make their own enzyme, okay, and in the as a result, okay, their hands or their feet get worse. Okay, because enzyme itself, although it's organic, but it can be harmful to our skin. It's not the same. It can be harmful. Okay, organic thing doesn't mean that it's mild. It is organic, yes, but it can be harmful to our skin as well. So please use the safe formulated enzyme over here. So this snap is free of phosphate. Okay, phosphate, this ingredient, it causes pollution in our ocean. Okay, when it's expelled into the ocean, it causes the overgrowth of sea algae that reduces the oxygen level in the sea. Okay, actually damage the sea life. Okay, so we do not want detergent with phosphate. All right, so what I realized is that this detergent, it is stabilized throughout, even in all water temperature. Sometimes you will see that in certain detergent, right, it will say best to work within this range of temperature. Okay, because the warmer the water it is, actually it cleanses the clothes well. Okay, even more clean. Okay, but then it also damages the fabric of our clothes. So best is actually to use low temperature, but most of the detergent, especially those non-chemical detergent, right, it doesn't work well in a cold temperature, cold water, but not with our snap. Okay, our snap work well in all water temperature. Okay, if you're having large loading, okay, it may cause you can use this one bottle, it can do up to 40, okay, 40 times, okay, laundry. If it's a small loading, okay, 80 times. So actually it save a lot of money also with this, and save our skin. Even you can wash it even for baby clothes, okay, because it's organic and organic non-chemical. Okay, triple enzyme laundry detergent, non-toxic. Yep. So the rest is like next. Right. Okay, so how about dishwashing liquids? It's the same. Okay, something that we use every day. Okay, even several times a day, we need to pay attention on this. Okay, okay, thinking of that, you may say, okay, I can use the normal dishwasher, but I use glove. But trust me, 9 out of 10 patients that I had before this, we always advise them to use glove. We cannot say, oh, use this non-chemical dishwashing, okay, because not everybody can afford it. Okay, not everybody is a franchise owner like us. We have a cheap product to use, but not everybody afford it. So what they can do is by using glove, okay, while doing all this housework. But 9 out of 10 cannot do it. Why? Because we are rushing. Housewife has so many things to do. Okay, if once they put on their glove, it actually make everything slow. It delay every activity, slow down everything. So they don't like to use glove. Okay, so most of them will have a recurring problem. Okay, so now why don't we just change the dishwasher? Okay, change the dishwasher to an organic one, to a non-toxic one. Okay, and it has aloe vera to protect our hands. Okay, make our hands soft while cleansing. Okay, this step dishwashing liquid, right, it has a lot of foam. Okay, I like to use with the bottle that came with last time. We have this 5-in-1 snap kits. I like to use the pump, okay, the bottle. Okay, it always creates a lot of foam. Even with a little bit amount of foam, it can clean the plates and these utensils quite well. So phosphate free, again, non-toxic to the environment, biodegradable. All of these container are biodegradable. Okay, they can be disintegrated. Okay, so it contains a plant-based surfactant. Usually the surfactant that we use in a chemical detergent or dishwasher consists of chemical. Okay, so it's chemical, it's not organic one. So here is a plant-based surfactant, so it's organic. Okay, it's not toxic to the environment and not toxic to our hand as well. So I definitely love this. Okay, all-purpose natural concentrate. Okay, it depends on what kind of stain you want to remove. If it's a very stubborn stain, so you just make it thicker, the concentration thicker, okay, and it works just fine. If you don't need that's concentrated, you just dilute it with more water. Okay, you can remove those stubborn stain like ink, pen ink, yeah, shoe polish, lipstick, auto grease, everything. So if you have these 3 bottles at home, basically you can do all the cleansing job already. Okay, this last one is the heavy duty concentrated. So for even more stubborn stain like kitchen stain, yeah, you see those toilet, okay, those long, I don't like to see this actually. So I do not, I don't like to clean toilet. I leave it to the maid. Okay, so if you love your maid, okay, please buy this for them. All right, so basically that's it. Okay, we still have like extra 10 minutes. I can slowly answer your questions. Okay, not moving. Oh, okay, catalog, of course, you can get it from your back end. Okay, you have 3 languages in there. And the last, okay, so I think I will tell myself, I promote myself. So uh, on the 12th of June, there will be another health and nutrition seminar by me. Okay, we focus on the digestive tract and skin health. Okay, if you're interested, you can get it from the back end. Okay, it's an online Zoom meeting. Okay, so now I will go to your questions. Okay, can I know if our fish oil is in EE form or TG form or RTG form? Do you know where can I get this info? A very good question, yeah, because I was asked by one of the participants last time also. Because I'm doctor, sometimes I don't really pay attention on this EETG, yeah, but I did forward these questions to our product manager. Okay, she answered me, our product is actually this EE form. Okay, EE form. So that's all I can tell you this. All right. This info generally you can actually email to Market Malaysia if you really want to know, yeah, to get a confirm answer. If already having a serious Alzheimer, evergreen is still good to be taken. Okay, first of all, you have to know what is Alzheimer. Okay, Alzheimer, basically there are a bit different. There are many risk factors of getting Alzheimer. One of it is actually genetic. If you have family members who get Alzheimer when their age is younger than 50 years old, most likely is a genetic inheritance. So if it's genetic, okay, you prevent will be better than cure, of course. Once what is Alzheimer? Alzheimer is actually your brain tissue is getting atrophic. Okay, atrophic, dying off, slowly dying off. Okay, your brain tissue is slowly dying off. So when these tissues or cells has already died, okay, basically it is very difficult. Okay, probably impossible to reverse lah. Impossible to reverse. What can you do now? You want to prevent it from dying further, from the brain from dying further. Okay, you cannot undo what damage. You cannot undo the damage that has already been done, but you can prevent further damage. All right. So for Alzheimer, the products, if you're looking into product, right, for Alzheimer, our product, the best will be actually curcumin extract. Okay, curcumin extract is one thing. And then Pecnogino has a few researchers on improving the cognitive function of our brain. Cognitive meaning the function of our brain. Doesn't matter it's for memory or for the reaction or for calculation. Okay, it can actually increase the cognitive function of our brain. These two ingredients. Yep. Okay, so did I answer your questions? Okay, so better take these 2. Okay, for prevention is better than cure. Take it early if you have this genetic issue. All right. And my PC preferred customer, is it okay? Having tonsillitis, what supplementation can help him? Tonsillitis, all right. Tonsillitis, right? There's 2 types. One is acute, another one is chronic. All right. Acute tonsillitis usually is caused by inflammation by virus or bacteria, right? So this process is reversible. Okay, you don't have to do anything. Probably you just take antibiotic, drink more water if it's mild, and take vitamin C, okay, to help your immune system to work better, and then it will actually recover. But if you have a chronic tonsillitis issue, meaning that okay, tonsil, what is the function of tonsil? Okay, there are a lot of immune cells actually in our tonsils. It helps to guard our mouth area. Okay, you know, our mouth is always exposed to external environment, right? We eat, okay, we're exposed to food, okay. There are a lot of harmful substance that can be on the food, bacteria, viruses, okay, whatever. So we breathe also, it's the air is also not pure, right? It contains quite amount of viruses and bacteria. So all these things will pass through we call this is our, in medical term is nasopharynx lah. So in our mouth lah, okay, generally our mouth. So we need a good immune system to guard the lining of our mouth to prevent us from contracting these illnesses. So all these immune cells came from tonsil. Okay, so tonsil, if it's overactive, okay, it will cause this overreaction of immune cells, and it will cause chronic tonsillitis issue. A little bit of inflammation, your tonsil will inflame, okay, and then painful and sore throat. You often get this thing. Actually, yeah, if it's not too big, right, we do not remove this tonsil. You can see actually ENT are doing quite a lot of procedure on removing the tonsil, good or bad, okay. Basically, if your tonsil often get inflamed, it doesn't work properly anymore already. So it's best to actually just remove it. So if it's not that severe and you want to help your immunity, I will recommend you can, my personally it's an immune thing, to strengthen your own immune first, okay, in order for your tonsil to suppress the activity in your tonsil. One thing is omega-3, okay, omega-3. You can always take more omega-3 to suppress this overstimulation of immune system. OPC3, okay, and if for external wise, right, I will a little bit is not recommend. It's not written in the official message lah. But if you ask me, I will use sometimes this bromelain enzyme to actually just gargle it, okay? Because it can break down the bacteria and the pus, caused by these viruses and bacteria. Yeah, gargle it like 5 to 10 minutes. This is just a personal advice, not by Market Malaysia. Okay, so drink a lot of water as well. I've currently taking allopurinol. Can I consume bromelain at the same time? Yes, you can. Okay, I'm guessing you have a uric acid problem. Okay, so gout problem. If you're already taking allopurinol, it has been quite many years. I think that it's quite stubborn that it will not go away. Of course, if you have issue with uric acid, best measure is actually to alter your lifestyle. Really, gout is a lifestyle issue. It's a lifestyle diseases. If you can alter your diet, you drink a lot of water, exercise, okay, your gout issue will actually resolve. Okay, you don't have to even take allopurinol. Okay, if you're not genetically prone to this thing. All right, so you can definitely take bromelain. All right. If you're having gout attack, right, okay, especially gout attack, painful arthritis, right, yes, you take bromelain to reduce the inflammation. Make sure you drink a lot of water. OPC3 is good in this also. So what else? What advice on supplements for patient with heart problem who had undergone angiogram? Okay, angiogram is a diagnostic procedure, so I'm guessing that probably you are asking for heart, this coronary heart disease, maybe the heart vessels problem, or heart attack, I'm guessing. Okay, so risk factor for heart attack again is atherosclerosis, okay, smoking, okay, genetic, stress issue, lifestyle issue, okay. So to tackle atherosclerosis, first of all, just now I've already mentioned, phenolginol in omega-3 is good. Phenolginol in OPC3 is good. Omega-3 bring down the cholesterol level, okay, and then do not forget, okay, a very good antioxidant for heart health is actually also astaxanthin. Okay, for smoker, please, you can take astaxanthin to reduce cholesterol. If your friend is having a bad digestive health, right? Maybe constipation. Okay, often introduce fibrosol 2 which contain in our Nutri-Clean. Okay, it can help to bring down the cholesterol level as well. Okay, lifestyle. Remember. Is there a good way to explain the sugar level in isotonics product if people are concerned? A good way, my way of explaining it is, okay, there are different, I don't know whether it will be too scientific for you or not. Sugar, there are different type of sugar, some sugar will bring up your blood level drastically. Some sugar will not, okay? For example, those fruit derived sugar, like fructose, okay? Those natural sugar, it will not bring up your blood sugar drastically, okay? This is what we want, okay? Those synthetic sugar, for example, the corn syrup, right? Those synthetic one we use in our, outside food, is not a healthy sugar. It will bring up drastically our blood sugar that will impair the pancreas from functioning properly, and then it will cause diabetes issue, okay, in a long term wise. Okay, so the sugar contained in our isotonics is very, very little. Okay, it is almost equal to your, like, 4 to 6 cup of isotonics is almost equal to the sugar content of taking one apple. Okay, if you are not worried about taking an apple, then do not worry of taking isotonics. It will do good, rather than you don't have to worry about that sugar itself lah. And remember, when we take isotonics, we take it in an empty stomach. Okay, we want our stomach to move and expel this isotonic into small intestine. We need a basic amount of sugar to do so. Okay, so the sugar in isotonics is already been used, okay, into to digest, to move this product into the small intestine. So if it's used, then you don't worry that it will actually elevate your sugar level. And yeah, basically that's it. Okay, this is my way of explaining the sugar content. I'm not really worried. I will tell that if you're worried about your sugar level, then probably you have to reduce 1 to 2 spoons of rice every day. Okay. Okay. So is that all? Okay. There's a past 9:35 already. I think we have to end our session today. Sorry if I didn't answer all of your questions, and I hope you enjoy the session today. The knowledge that you get from here, I hope you can share it with your family, okay? Share it with your friends to help them to overcome this health issue, okay? Health is the most important thing during difficult time. Without health, we cannot do anything. So make sure we are healthy. You have good products, okay? So use it wisely, okay? Help yourself, help your surrounding, okay? So thank you.
All right, thanks for the great sharing from Dr. Ng and her patience in answering all the questions posted here. It's literally a non-stop presentations and an explanation for the past 2.5 hours non-stop, okay? It's definitely tiring and exhausting. And the good thing is we are just paying like ringgit Malaysia 20 ringgit for this course. So how good is that? And I believe Dr. Ng is deserved to have a round of applause for her wonderful sharing tonight. And thanks to all of you who attended our product overview tonight. And I believe you all are benefited from this seminar because this company has real great products. And if you are new friends today, we hope that you can join our next product seminars, which Dr. Ng has been sharing just now. Let me open the PPT again. All right, this is one. So the next product seminar will be conducted by Dr. Ng again. It's on the, when is that? So it's about digestive system and also skincare. So if you are not a franchise owner, you may ask your franchise friends to register this course via a registration link, and you'll be getting a confirmation email from the coordinator, all right? So thanks for tonight. It's a wonderful night, and I hope that all of you stay healthy and stay safe, and hope to see you again. All right. Okay. Good night, everyone. Bye. Thanks, doctor.